Drug information is probably one of the most important topics to know about, and that's because it's impossible to learn all the drugs in a 6-week period. Even an experienced pharmacist doesn't know all the drugs because medicine changes so fast. New studies come out every day, and dozens of drugs come out every year. So it's important to know where you can find reliable, up-to-date, unbiased information. And I can tell you that Google is not your go-to source. You may get advertising that's disguised as drug information, or it may be out of date, or just promotional information. So don't use Google as your source of drug information. I'm going to show you 2 online references that I consider the most reliable, and the 2 I would like you to get familiar with. So if you can't learn it all, at least you can know where to look it up.
Your book claims that the PDR, or the Physician's Desk Reference, is a very good source of drug information. And that's true. It can be an excellent reference if you understand its limitations. The drugs in the package insert are only the indications that are provided in the package insert are only the indications, or what it can be used for when the drug was originally tested by the FDA and approved. And that could have been 20-25 years ago. Since then, the drug has been studied under other conditions for other indications, and there may be very good literature to support its use for other diseases. Those are called unapproved uses. Now, the term unapproved uses sounds like it might be illegal or something, but it's not. It just means that more research has done since the drug was originally approved, and now it is used for other diseases. Secondly, the package insert may contain legal limitations. For example, this is common in the breastfeeding and pregnancy categories. If there's not much information available on whether a drug can be used during pregnancy or breastfeeding, the lawyers that are involved in writing these package inserts may say that it should not be used during pregnancy or during lactation, even though there is no evidence that anything bad could happen. It's just stating that there really is no information. But the statement that it can't be used in pregnancy or lactation makes it sound like something bad would happen. All right, so the other thing is, how do you find the correct package insert? And believe me, when I've gone to look for information for the package insert, I often find the wrong thing. For example, if you go to pdr.net, that information is so much information that it takes too much time to wade through it. And you don't want, as a student learning about drugs, you don't want too much information because you don't know what is the most important information, and it takes too much time to sort through it. So don't use pdr.net. And if you use Google to find the package insert, you may type in a drug name and then package insert, and package inserts will come up. But often they are outdated, and then if they're not updated, they won't have the correct information. And it's actually very hard to find the publication date. So again, I don't recommend using Google for that source of information. The best reference for finding the correct PDR is going to be the reference I talk about next, which is the National Library of Medicine, National Institutes of Health, and the website is nlm.nih.gov. Okay, so the first reference I want you to become familiar with is the National Library of Medicine, National Institutes of Health. And they have a plethora of information. You'll find all kinds of disease and drug information on this site. I'd like you to spend some time getting familiar with it. They provide primary literature, drug research trials, several databases. This one called LactMed. Is the best source for information about whether a drug is safe to use in pregnancy. Remember, I said that that's sometimes hard to find. And as I mentioned in the previous slide, this site, the NLM, is the best site or source for drug package insert or PDR labeling. Those are both references to the same thing. So the current package insert. It also has a pill identifier and information for lay people, consumer drug information. But take a look and see how much information they have. It has a medical dictionary. You can get free full text articles. A lot of times you'll find an article that you want to read, but then before you can open it up totally, it says it's going to charge you $20 for that. So you can get free full text articles through this source. So very good source of information. Okay, I'm going to walk you through how you find the package insert for a particular drug. Open the site, nlm.nih.gov, and this screen will come up. And just click on this little list function, and this will come up, and click on Resources for You, this one right here. And when this list comes up, pick for healthcare professionals. That provides the most detailed information and information that a layperson wouldn't understand. So this is for healthcare professionals like doctors, pharmacists, nurses, and coders. Next, this section will come up, and right here it says Locate Drug Information. That's what I want you to click on, Locate Drug Information. And then the next screen will have the first subject is DailyMed. Click on DailyMed. That's their new drug information site. And when DailyMed comes up, right here, you type in the drug that you're trying to find right here in this text box. Once you have DailyMed opened up, you can type in the drug that you're interested in finding information for. For example, I'm going to use metformin as my example to demonstrate how to find drug information. So I typed in METF, and right away metformin came up, so I selected metformin. Then all this information came up for metformin, and it has each category of drug information, which you can click on these to expand that to find all of the information. Or what I would like to show you right now is that you can download the drug label or the package insert just by clicking on this PDF. And when you do that, the actual package insert or drug labeling information, as they're both equal the same thing. So a PDF file of metformin's package insert will come up. The second reference that you will be using is the Merck manual, and this is one of my favorite references to use. It has a lot of good information. It's unbiased, easy to use, it has a pill identifier, and it contains drug information on all uses of the drug, including FDA-approved uses and off-label uses. It also has treatment guidelines and good information about diseases and conditions. And you'll find this reference very useful when you do your patient case presentations in the following weeks. For this reference will be an excellent reference to use for your assignment this week. Your assignment this week will be to provide a report about a drug that you will be assigned. Each student will be assigned a different drug, and you are to find the following information about your drug. Provide the generic and the trade name, and I would like you to find out the correct pronunciation. This is simple to do. Just Google the drug, and after the name of the drug, type in pronunciation, and you will find both a verbal pronunciation and a phonetic spelling for that drug. I want you to identify the therapeutic class and the mechanism of action of the drug. Provide the indications, both approved and off-label uses, contraindications, precautions, adverse effects, and toxicity if there is some, and drug and food interactions. And you will be assigned a time. I'll be talking to you, and we can come up with a mutually convenient time for you to meet in the online classroom and present this information to me in either a Word document or a PowerPoint document. For the rest of this presentation, I'm providing you an example of how to find the information that you'll need to do your assignment. So my drug is metformin, and first of all, you select on the Merck Manual homepage, select professional information, select drug information, and then select your drug. Scroll down to find each category of information. Now, one thing I want to note is I don't want you to copy all the information. I want you to read through the information and summarize it succinctly. So for the first piece of information, you'll have the drug name, how to pronounce it, metformin, and some of the brand names in the United States. The one I'm most familiar with is Glucophage. You don't have to provide all the brand names, just one or two is all you need to do. Then you find the pharmacologic category. It's an anti-diabetic agent in the class of biguanides. Its mechanism of action is that it decreases hepatic glucose production and increases glucose uptake in the tissues. To find the indications, you'll scroll down to indications, and the main indication for metformin is type 2 diabetes. What I did is I summarized the indications. Type 2 diabetes is the main use. It can also be used for polycystic ovarian syndrome and prevention of type 2 diabetes. It's occasionally used to treat gestational diabetes. That's diabetes that develops during pregnancy. And the off-label use is right here, and that's antipsychotic induced weight gain. So it's when patients are taking antipsychotic drugs, they often gain a lot of weight, and metformin can be used to prevent some of that weight gain. So that's its off-label. The next category of information you need to find is contraindications. So scroll down to contraindications and summarize those in your document. Contraindications means these are situations where the patient should absolutely not take this drug. So that would be allergy to metformin, acute or chronic metabolic acidosis, and severe renal function, defined by creatinine clearance less than 30 milliliters per minute. I scrolled down again and I found the precautions. And since lactic acidosis is one of those very bad complications that can occur with metformin, the precautions are lactic acidosis risk factors. So patients that have renal impairment or that are on concomitant use of certain drugs that inhibit carbonic anhydrase, such as topiramate and acetazolamide. Patients that are over 65, patients that are undergoing a radiologic study with contrast media. Certain contrast media can cause a decrease in renal function temporarily, and that can increase the risk of lactic acidosis. Patients undergoing surgery or that have hypoxic states, in other words, some reason that their organs are not receiving enough oxygen, and acute heart failure is an example of that. Excessive alcohol intake can cause an increase in lactic acidosis and hepatic impairment. With long-term use, a vitamin B deficiency can occur, and vitamin B12 may need to be supplemented. All right, next I scroll down to adverse drug reactions. Now, when you look at adverse drug reactions, you'll find that there are thousands of them. So how do you sort out what's important and what isn't? Basically, we are looking for adverse reactions that are serious and that occur a lot, in a lot of patients. So any that are greater than 10% are significant. So note the incidence. If the incidence is provided, we're looking at those that are 10% or greater, or some serious ones that are 5% or greater. If the information is listed as compared to placebo, that helps you interpret this information a little easier. So in case studies where they've done given patients either metformin or placebo and not knowing which one, even placebo receivers have adverse effects. And also note that almost every drug causes nausea, vomiting, upset stomach, and headache. All right, so here's an example where in this particular study, metformin was given to some patients, and placebo was given to an equal number of patients. And then the side effects were recorded. And you can see here that diarrhea occurred in 53%, more than half of the patients receiving metformin, where it was only about 12% in the placebo. So diarrhea is a significant side effect with metformin. However, that's mainly in the beginning when you first start taking it, and your body adjusts to it after a while. But it's real interesting to see that placebo can cause 8.3% of the population to get nausea and vomiting, but 26% in the metformin group got nausea and vomiting. All right, drug interactions is another category that can be very problematic in that you can get too much information. Many drugs will interact slightly, but it's not clinically significant. So when you find a list that contains thousands of drugs, how do you figure out which ones really should not be used with the other? So I would consider it mainly those that have a risk X, where you absolutely cannot use those two drugs together. Even risk D is possibly can be used together, although there's usually an alternative therapy that is equally effective. So I look for the risk factor X, and so when you scroll down this list of thousands of drug interactions, I boiled it down to this: alcohol in excessive intake, carbonic anhydrase inhibitors like acetazolamide, which is Diamox, lamotrigine, which is an anti-seizure drug, maybe, and as we mentioned in a couple of slides ago, contrast media, the medications that are given to outline organs or veins or arteries in an x-ray, some of those can cause renal impairment. So diatrozoate is okay. Cimetidine, which is an H2 blocker, that should not be used, but there are plenty of other H2 blockers like Pepcid and others that can be. And then this particular drug, which I'm not sure I can pronounce, dolutegravir, which is an HIV drug, the metformin dose has to be limited to 1,000 milligrams per day or less to use it with this particular drug. Okay, so that's pretty much it. This is the information that you will be providing in your assignment, and you can present it as a Word document or as a PowerPoint like I have. but you will have to present it verbally to me in a meet session. And I will be communicating with each of you, assigning the drug, and finding out when you can meet with me to present this information to me. Okay, that's it for tonight.